Doctor, could you explain how diabetes leads to health complications in general?
Right. So this is a very good question. This is how it works. So we know that in diabetes, there's a lot of sugar in the blood vessel, right? So that's how we find out. When there's a lot of sugar in the blood vessel, it causes inflammation over the blood vessel wall, right? So that means there's injury over the blood vessel wall. And when there's injury there, this blood vessel wall, right, will actually get blocked, okay? So this blood vessel over time will actually get blocked. So whenever the position of it gets blocked, right, that's where complication will happen. One example. So if the blood vessel is blocked in the brain, it causes stroke. Blocks in the eye, it causes blindness. Blocks in the heart, it causes heart attack. It blocks in the kidney, it causes kidney failure. It blocks in the leg, causes numbness, which is followed by amputation. So I believe in terms of hearing, it's the same mechanism where there's actually inflammation of the blood vessels in the ears, and that actually leads to the problem.
As what Dr. Andrew has explained earlier, this is actually our organ of cochlea. So cochlea is the organ, our organ of hearing that helps us to channel the sound, acoustic sound, and then become the electric signal and channel it to the brain so that we can interpret what sound was that. What happened for this blood vessel? It will continuous to bring nutrients and also the oxygen to the organs. However, when someone is having high blood sugar, somehow it will actually cause the nutrients bringing inside is actually reduced, or even it would interrupt the oxygen exchange level. So hence, what happened once the organ of hearing, which is the cochlea, lack of oxygen or lack of nutrients, they are somehow degenerate faster. So when they degenerate faster, hearing is permanently affected. When this happens, it will cause hearing loss. So this is actually our cochlea. Inside the cochlea, we can see that we have different hair cells. But for someone who already have hearing loss, what happened is under the microscopic examination, this is what they will see, the damaged cochlea. So you don't see the same lining, like this one, the very nice lining. This is because the hair cell is already dying or degenerate. So one of the reason why they degenerate could be because of the diabetes condition, as I explained earlier.
I believe any diabetics who know about this fact, right, the first thing they will want to do is, how can I reverse my diabetes as soon as possible? Understanding this fact, you will know that the medications not only do not prevent the complications, they actually draw the patient closer to the complication.
Closer, meaning is like even worse.
Correct.
Ever since they started the medications, then they are closer to the complications.
You think about it, it's simple, ma. The sugar is initially it's in the blood vessel, ma. Example, let's talk about hearing loss, lah. Now they push the sugar to the cochlea, lah, to the hearing organ. So it's causing damage there, ma.
Okay, but one thing what I learned last time under this biology is that our blood, there is a blood flow, ma.
Yeah.
So there's a blood flow, then it will somehow bring the things, including like, for example, the blood also bring the oxygen. Then it exchange with the carbon dioxide.
Yes.
And then after that, it will just channel out.
Yeah, they will dispose it in some way. So you see, many of these sugar, right? Okay, the problem is there's too much, ma. So the sugar still has to go somewhere, right? So now you're forcing it out of the blood vessel, so it has to go somewhere. It will go somewhere, lor. So another example, it goes to the liver. And in the liver, it is not really stored as sugar, it is stored as fat. I'm pretty sure you have this thing called fatty liver, right?
Yes.
This is very common nowadays.
Yeah.
80 to 90% of diabetes suffer from fatty liver. It's actually coming from sugar. The fatty liver actually comes from sugar. It is not coming from fats. It's actually coming from sugar. So the sugar has got somewhere. It has to go somewhere. Okay. So other than taking that medication that can push it out, the rest of the medication just don't push it out. It's always within you. It's within the patient. If you are the patient, Do you want to take this medication for the rest of your life?
No.
It's still lifelong, right? You still have to take it for the rest of your life. Okay, this is the first question. No, the answer is no, right? Second, we are talking about side effects now. Imagine if your urine is always filled with sugar. Is that good or bad?
That's bad.
Why?
Really more.
Another disease.
I mean, I remember one thing is that sometimes if the sugar, your urine is also sugary, it may also attract the ants.
Correct. Okay, we're coming to that. Other than attracting ants, what else it will attract? Something that's very common among the ladies.
UTI. So
UTI?
UTI, correct, you got it.
Ah.
So patients who are on this group of medications, they tend to suffer from frequent UTIs. Yeah, because the sugar is there. So you're literally giving food to the bacteria. So that's why you get frequent UTI. So is there side effects? This is the side effects. And it's logical. It's not something like super high-fi. No, it's not. It's just logical. Sugar is there. That's why there's UTIs.